I'm not against peptides or hormone replacement or any of that, but people see something new and they jump into it, and that is the biggest thing clinically that we've seen with clinical medicine, with regenerative medicine, is that they're early adopters. They have no idea the long-term effects. They don't know how this works on a molecular, cellular, or system-wide basis, but people are jumping in.
Behind the practice.
Welcome back to Behind the Practice. I'm Katie Brinkley, and we're in for a treat today. We're sitting down with Dr. Doug and Dr. Nick. Thank you so much for joining me on Behind the Practice, because you guys are building something that really spans nutraceuticals, regenerative biology, and neuromodulation. The thread tying it all together is you two. It's something that's very different, very distinct, that we're not seeing in a lot of traditional medicine. You guys have created a collaboration between bench science and clinical practice. Why is that collaboration so broken in medicine today?
I met Nick about 2.5 months ago, and it was one of those epiphany moments for me. And I walked into his lab, and first he explained something that he was doing to me, and I was like, wow. So his paper that we'll talk about a little later is mind-altering and medicine-altering. And then I was developing a number of platforms. One of them we've started developing together. And the idea in medicine, and the biggest thing that is really missing in science, I spent years as a regenerative medicine doctor working as a stem cell scientist by shift, but I was always a clinician first, kind of a biology guy second. And one of the best things I ever learned was from another PhD. And in having a collaboration with a scientist, you bridge the gap in knowledge.
And Doug coming into my office was just at the right time. For the last 7 to 10 years, my lab's been interested in bench to bedside, bedside to bench, reciprocal interactions, and trying to push science by understanding patients. And we've brought Prader-Willi syndrome patients into the lab. We're working with bipolar patients to look at how the brain influences decision-making and affective disorders. And when Doug came into my office, I was like, this is the perfect opportunity to expand our work into ways that can truly affect health. And I think the R-Cubed platform that we've come up with together really centers around health at the intersection of ways in which we can improve people's health.
Yeah. I love that this partnership is so recent, because I can still feel the excitement behind the changes that you guys are making in the medical industry. It's going to change so many lives. And the partnership that you guys have, it's not in every single medical study right now. The partnership between lab and clinic, how do those therapies really combine together to make something happen as quickly as it has?
So those are great questions, Katie. And one of the first things, I think we have to look at the different things we're doing. When we talk about Replenish, our basic vertical there is nutraceuticals. So when I got into trouble about 4 years ago, I had a bad reaction to a flu shot. And I developed an autoimmune reaction. And I was on prednisone for 9 months. Out of shape, bad insulin sensitivity, gained weight, lost muscle mass, lost cuts, lost strength. And I wanted to look at something different. I wanted to look at a way out without steroids or peptides. So as I looked at the nutraceutical workspace, I saw a bunch of different companies out there, some of which I liked. But working as a stem cell scientist, I saw holes. So a lot of other people had worked with the 12 pillars of aging. And I said, well, we need to deal with that in redundancy and synergy. And then I looked at other multiple mechanisms of action. And when I spoke to Nick, he agreed with me that there are things that were missing in the space.
And I think what was really interesting is you're looking at a lot of these components that you've used to address the 12 pillars of aging and things that improve your health have been studied extensively individually, but nobody's ever looked at them in synergy. And one of the things that we talked about that was missing was understanding what time of day to use these supplements.
Right, so
I was going to say, when you say replenish, what exactly are you replenishing in the body?
So when you look, we have a circadian rhythm, right? We wake up because that's the time. Sometimes we're triggered by sunlight. Sometimes we're triggered by hunger. There's a number of things that happen biologically in our nervous system. So in the morning, you want to wake the engine up. In the afternoon, you kind of want to have some metabolic control. And at night, you want to repair and reset. Certain things that are in our nutraceutical mix are better in the morning on an empty stomach. Certain things have better nutrition bioavailability, if you will, after a fatty meal. And some things are simply better to reset you at night. Things like senolytics work better at night.
And I think one of the things that we're excited about working together is that rats and mice have a metabolism that's 5 to 7 times that of humans. And so we can rapidly assess the effects of taking these things for a month in a rodent, and that's like almost a half a year for a human. And we can also look at many different endpoints. So how do you know it's affecting the brain? Well, in a human, that's a lot harder than it is in a rat, where we can do investigations where we're doing invasive studies, right? And we're going to look at what's going on in the brain with brain aging, brain development, brain activity, but we're also going to look in the muscles to see if muscle metabolism is going well, to look at things like PGC1 alpha that's important for mitochondria and the master regulator of muscle remodeling. And then we want to look at inflammation in the immune system, and see if inflammatory markers go down if you're taking the JevRx mix of supplements at the right time of day versus animals that don't have access to these supplements.
So, Katie, I've biohacked this myself for about 2 years. So I'm currently 61 years old, and I work full-time in clinical medicine, and I'm running number one in Mr. Health and Fitness in my division.
And Doug has more energy than anybody I've ever interacted with. When I wake up at 5 a.m., if there's not a text message from Doug, I reach out and make sure he's alive.
So our second vertical, which is really important, I spent years working in the clinic with placental stem cell exosomes. And I probably treated 1,000 patients. And through my lectures, I oversaw about 10,000. And standing in those rooms, I couldn't help but think, if this is what untrained science is doing, what would happen if we could really train the science?
Yeah, so Doug, how are you going to train the science? What was your critical thought on how to train these exosomes, train the science to treat patients?
So I had a lot of benefit. I saw things like vitiligo treated. I saw infertility treated. I saw changes in immune function and inflammation. Neurodegenerative diseases I was able to treat with just the placental MSC exosomes. So I thought to myself, I said, these are just generic products. And with the FDA landscape, those things are never going to fly, because while it's proprietary how we make those things, unless you add a little something, not really patentable. Yeah. And in the end, you want to play within the four corners with the FDA. You want to create a patentable step, so at some point, Big Pharma can join with you. So I said, well, let's add some stuff. So all of the patents we've written either have little snippets of RNA inserted in, microRNA, just 18 to 22 base pairs, little pieces, or we put a little targeting ligand, the protein on the outside, so they go specifically to certain cells. So we can drive the changes where we want them to happen.
Yeah. So what are you seeing with what you guys are doing? Where are most regenerative medicines going compared to what you guys are doing?
So from a bench side, you want to address that?
Yeah, so I think a lot of what's happening in regenerative medicine isn't assayed in animals. So there's no way to really understand the molecular and cellular mechanisms that are being changed. People look at epigenetic age, right? But that's just one potential readout of the many things that go on. We can look in one given study, we can look at 10,000 different markers in an animal, and we can look at every organ in the body. And that's really hard to do. You're not going to biopsy a human in every organ of their body to get a readout of what's going on.
One of the things I like, and if you look at TikTok and Instagram and all these different pay-to-play structured places where you can see people talk about stuff, there's a lot of social influencers. Everybody's jumping on the peptide bandwagon, right? There'll be a huge Netflix special about that in a couple of years. But I'm not against peptides or hormone replacement or any of that. But people see something new and they jump into it, and that is the biggest thing clinically that we've seen with clinical medicine, with regenerative medicine, is that they're early adopters. They have no idea the long-term effects. They don't know how this works on a molecular, cellular, or system-wide basis, but people are jumping in.
Yeah, and that's true. I see that in our space with peptides. I've worked in the feeding field for 10, 15 years, and people who aren't overweight are taking GLP-1 drugs right now. without knowing what a microdose does to you. And those studies haven't been done in humans or animals yet. So we think together we're going to be able to bridge the gap between bench and bedside much more efficiently than we would ever be able to do alone.
Well, one of the things that I was going to say that was really interesting between your guys' partnership is that you have the in-person, the clinical studies, and you have the bench, the science side. What do you think the biggest misconception is about stem cell products from both? Because I'm sure your answers are probably different from what you've heard and what you've heard.
So one of the reasons we like birth tissue exosomes is there's no risk of teratogenesis or cancer. They also home to certain cells. They're anti-inflammatory. They're pro-growth. Those are certain things I like as a generic when we're talking about placental exosomes. One of the other beauties is that we're not theory first, animal first. We are clinical first. So we're utilizing these things based on treatment modalities that previously worked for me.
And from my perspective as a bench scientist, one of the things you hear about stem cells is that these are embryonic derived and a fetus had to die for this. And what happens in the lab has nothing to do with that most of the time. So the misconception is that you have a really powerful tool that's essentially a waste product of birth. And people are afraid of it because it's been politicized.
Oh, yeah. And that's a wonderful point. I think that once the politics come into it and what people are reading or think they understand, that's where we have to help with the mindset shift. So how are you guys? We've talked about replenish, we've talked about repair. Let's talk about rejuvenate a little bit. So that's the third part of.
So this was one of the sentinel moments in my life where I had to stop and pause. I've had two other moments in my life. Somebody taught me about erythropoietin, Epigen, when I was a freshman in college, and they wanted me to put $10,000 out of my pocket. We'd be millionaires in 2-3 years. And at the State Medical School of Brooklyn, I didn't have that $10,000, nor did the kids next to me. Then I walked into a conference about 10 years ago, and I heard someone talking about exosomes, and it blew my mind. And I pioneered that space, and I never looked back. 2.5 months ago, when I walked into Nick's office, I was blown away by his paper, and I really want him to introduce that because this was like a George Jetson period of my life.
I love it.
And it's funny because we had been working so closely in the scientific space, it wasn't even profound to us at the time. And what we started to do is my lab is really interested in understanding how the body and the brain communicate with each other to influence health outcomes. And we started to study exercise as something we know is healthy for everybody. And we wanted to understand what exercise does to the brain and how the brain then is changed. And what we found was something completely different, something completely shocking, and something completely unexpected. What we found is that when you exercise, the brain is activated. And that was known before. But the signal that is sent to the brain is 100% necessary for you to get any of the benefits in your body. So your muscles don't get stronger, you don't build endurance, you don't gain cardiovascular benefits if the brain is not turned on by exercise. And then we did a proof of concept experiment that could only really be done in animals at the time, where we had animals receive an extra 30 minutes to an hour of stimulation in a key hypothalamic brain region after they exercised. And we compared them to animals that just had exercise training. And what we saw blew our minds. The animals with the extra stimulation ran twice as far as the animals that didn't get the stimulation. So they were twice as fit, they had twice as strong muscles and a better cardiovascular system and all of the molecular markers of muscle adaptation.
And this blew your mind.
So all of a sudden it blows my mind because now I'm looking at clinical adaptation. So if you've read enough in the science space, you know people are using LIFU, low intensity focused ultrasound, and they're using it for two reasons right now. They're using it not to destroy tissue, but to either open up the blood-brain barrier with microbubbles. So if you had an area of Alzheimer's, we could look at functional MRI. We could give you an antibody that might pull out some of those misfolded proteins after LIFU and a little bit of ultrasound and a little bit of microbubbles, and that opens up for 24 to 48 hours. Or without the microbubbles, we can just stimulate portions of your brain. And I looked at Nick and I go, bingo. So we got together and we collaborated on a patent where we're going to use LIFU to stimulate that area of the brain.
I mean, this is paradigm shifting.
This is a change in medicine and science that nobody's ever understood. This loop, the loop between muscle, brain, and muscle was never explained. I've not seen it in a textbook.
I mean, I joke about it with Doug and I say it gives a whole new definition to meathead. Your brain actually is the key driver of this development of your muscle.
Yeah.
So we went out and we found a company that offers LIFU for rodents. And then we looked, how plausible is this? Because a lot of the LIFU now, you have to get a functional MRI and MRI for stereotactic use. But now we realize that, you know what? These neurons sit in a pretty fixed space across from the midline, just above the sinuses. We think we can hit them just looking at standard CAT scans of people's brains, and we think we can fix it on the average person so that if you've got sarcopenia, if you're recovering from a physical illness, if you've got problems with a muscular dystrophy, we think just like computers started out and they were $100,000, we think this is something that'll be in the clinic, in the gyms, in the sports teams, and within 6 months, we think we can have an IND filed and be looking at licensing either inside or outside of our product.
In 6 months.
Yeah.
That's the advantage of doing rapid animal studies.
Yeah.
We can have, within a month, we can show that we can activate the brain, show that we can activate it specifically, and show that we're influencing the endpoints that we care about.
So you guys have got the patent. You guys have teamed up on this. Let's talk about what technologies like ultrasound or light therapy, how could all of those enhance exercise adaptation?
So, there's a synergy in what people are using to promote their health span. And the whole idea with Replenish is to maintain a longer health span. So none of us want to be caught in that dead man's area between health span and lifespan. In the U.S., you're looking at about 12 and a half years between the two. And I'm sorry to say, Katie, but if you're a girl, that's about a year and a half longer. So those are the areas where age-related diseases take hold of your body. So you've got cardiovascular disease, you've got neurological disease, you've got cancers, you've got type 2 diabetes. They're basically affecting your health span at that point. And once you get into age-related diseases and frailty, your life goes downhill.
And one of the things I'm really worried about in this space is the use, and I think GLP-1s are fantastic tools for weight loss if you're obese. But with so many people using them, one of the comorbidities of taking a drug like that is muscle loss. And muscle mass and the ability to stand up when you're sitting on the ground is one of the biggest indicators of morbidity. And we're worried that people, when they get to be 60 after going on 3 or 4 different cycles of GLP-1, won't even be able to stand up off the ground. And so what we're doing hopefully can bridge that gap.
So we have a patent for white adipose tissue. So we can give you an exosome laced with a ligand that will focus on white adipose tissue and beige it. Just like if you go into a cold plunge.
Yeah.
They'll increase uncoupling proteins, increase biogenesis, mitochondrial turnover, so that you're actually going to turn up the engine. So if you're coming off the GLP-1s, we have an answer for that as well.
So what would real life anti-aging athletic recovery look like a year from now?
So we're going to see, everybody's looking at longevity, escape velocity. When do we hit that point in time where for every year we live, we can turn back the clock? And people are playing with Yamanaka factors and other things like that. But for us, we have some proven metrics we can use. Red light is important, right? Because that increases your insulin sensitivity, increases your ability of the mitochondria in the cells to pull the sugar out of your blood. Exercise is important. 7 to 9 hours of sleep, mitigating stress, social interactions. Look at all the blue zones. All of these things make sense. We started with the nutraceuticals because we have to have something simple for people 20 to 70, men or women. Specifically, certain things aren't in there. Certain people we're going to have to fix after the problems have arisen. That's why we're starting with the verticals on exosome technology. And the other stuff, that stuff is going to be for everybody. We want to make everybody superhuman.
And I think one of the things that everybody who works in this space needs to do is figure out what are the endpoints that are important. to monitor for health span, right? We know a lot of these things, muscle mass, VO2 max, but what are the other things? What are the molecular signals that we can get from a simple blood test from a person who just walks into a lab? And I think that's another opportunity, be it more academic in nature than a company, but I think that understanding what are the key factors we should be looking at is something that's kind of the next frontier, part of the next frontier.
Yeah. This is very science driven. And sometimes it can make people feel a little nervous. How are you guys helping build that trust in that communication for people that this is all new to them?
Yeah, so I think each different platform entails a different level of explanation. When you're talking about nutraceuticals, these are essentially foodstuff-based nutrients that everybody's taking over the counter, but the average person lacks the requisite knowledge when to take them, how to take them, which ones to take. So that's an education, and educating a 20-year-old bodybuilding kid is a little bit different than speaking to a 60-year-old like myself who's trying to biohack, and I've got 2 young kids, 8 and 10 years old. I mean, I got to stick around for a while. So that's a little bit different pitch.
I mean, I think what's really interesting about this point is that even educated people who listen to science-based podcasts look at me when I start talking about these things, and they consistently ask me this one question: what are you trying to fix with this? Right.
So we can fix different things now, and we're going to drop more patents as time goes on, but we believe that there's a lot of mechanistic changes we can make because we know how the exosomes work.
But I mean, I think even one of the big things with the nutraceuticals is that we're actually not trying to fix anything. We're trying to fix your aging.
Yeah.
We're trying to fix you getting old and becoming morbid. We're trying to fix your health span. And that's a concept that people aren't really ready to understand, everybody. I mean, many people I've talked to have been like, I just want to be as natural as possible.
Well, so many people we've been trained to be symptom
first. That's where medicine
Symptoms first.
is. Yes.
Medicine, the problem is medicine doesn't recognize aging as a medical problem, right? So an anti-aging drug is not a drug that's going to get FDA approval, right? Aging is not a medical problem. But there are some things that are related to aging that may give you an orphan diagnosis or a fast track. People that have progeria, those are people that age out very, very quickly. In the first 20 years of their life, they die. It's like the opposite of Benjamin Button.
Yeah.
Okay. So those people understand that. So a lot of the things are looking at age-related diseases and looking to focus on a specific disease that you can fix in order to secondarily be able to get approval to do something else.
Yeah. So replenish, repair, rejuvenate, those are the 3 wings. 2.5 months and you guys have already made leaps and bounds of progress together. What does 5 years from now look like to each of you? So Dr. Doug, you go first, and then Dr.
So
Nick.
I think 5 years from now, first of all, medicine is going to change with AI. There's a lot of things that are going to be available to everybody. We're going to see things that are available now, and we can't imagine what's going to be available next. I think we're going to start living longer. We're starting to be healthier now. People will start adopting more things, and there's always new innovation. You have to keep your mind's eye on what's new and be able to incorporate that. Every time you hear science from someone like Nick, a clinician should start thinking, how do I use that on people? And if you don't continue thinking, you never innovate.
Katie, I think it's a really interesting question, and running a research lab for the last 10 years, I've always focused on what is the next 5 years going to look like? Where am I going to be in 5 years? And this is the first time in my life where I can't project what we're going to be doing in 5 years because the evolution over the last year has been so tremendous. We're at actually a critical nexus in the development of scientific advancement where big data is no longer a problem. We can collect more data than we can analyze. So we're going to be able to understand and unpack pretty much the entire health composition of a body. And I think the opportunity for medicine is just profound. We're going to be able to target and treat just about every disease we want to treat as long as the will to pursue the science and the clinic hand in hand is maintained.
Well, if people want to learn more, so much has already happened in such a short amount of time. If people want to follow your guys' journey, learn more about what you're doing, what's the best place for them to go to?
So we have both TikToks and Instagrams. I'm at DRDSPIEL. That's on TikTok and Instagram. JevRx will be launching that website shortly. The other websites will follow.
I have my personal lab webpage, betley.edu, hosted by the University of Pennsylvania. And I have my social media stuff, contacts as well, that we can list at the end of the show.
Yeah.
And we'll link everything in the show notes as well, but be sure to follow JevRx because they are just making strides at lightning speed, and really the collaboration that you two have brought together, I think, is something that's going to help bring the medical industry much farther along, much faster than we ever anticipated.
And we hope that it sets the stage for other people to follow along and also advance the medical field.
PhDs are our friends.
Yeah.
For years we walked, separately. We were like cops and firemen, but now we eat together.
I love it. Well, Dr. Nick, Dr. Doug, thank you again so much for joining me on Behind the Practice. This has been a great episode.
Thanks, Katie.
Thank you.
Behind the Practice is produced by Next Step Social and Podcasting and hosted by Katie Brinkley and Sean Quintero. A special thank you to our guests today. This episode was recorded live at the Boston BioLife Functional Longevity Summit. A special thank you to the team that helped make this podcast happen.